Hello, I believe I'm talking to an upcoming medical worker out there, and I do hope that this is someone who is, having their first experience in the ward or in the clinic, or possibly someone who is not having their first experience but is still interested in learning about how things are done around there. Well, if it's your first day around there, first things first, it's important that you get to know the place, understand where to find what, know how the system runs, know where to find the emergency medicines, know where certain drugs are stored, and so on. Learn how to adjust the beds, learn how, generally learn the entire environment, how it runs around there. On board, you need to go with the right attitude to learn. Your mind should be very open. I know some of you are simply upgrading. Perhaps you've done your diploma in clinical medicine and perhaps you're now pursuing a bachelor's degree. You might be tempted to think that you already know a lot, but as you know, as you go higher in the ladder of knowledge, there is always a lot of new stuff to learn. So irrespective of your prior experience or your prior knowledge, you should really be very humble and open to learn new things, because when you put that idea in your head that you already know, then you're really unlikely to learn new things. You're going to learn in different forms. You're going to learn from experiences shared with you by people who are also students like you but ahead of you, or by medical officers or surgeons or different specialists that have been there in the field for quite some time. It is very important to learn from these experiences because some of the things they will teach you are not things that are actually written in books. So it's very, very important that you attend ward as much as possible. Avoid this tendency of dodging and things like that. You miss out on a lot. You should be very keen to listen. I know the first days it's going to sound like everything is new because you're possibly transitioning from the basic sciences to the clinical world, so a lot of things that are going to sound and look very new to you, but the approach that I personally used to use is I had my notebook. Every single new thing that I would meet, I would write down, whether I understand it or not. A new word, maybe a new drug, and a new name of a disease, any new word, write it down. At the end of the day, go down, sit down. You don't really have to do a lot of reading about each of them, but basically you can just use your search engine like Google. Just Google and get a brief idea about that new word, and each day you learn something new. Your knowledge keeps on growing. The other thing that is very, very important to understand in the first days of clinical experience is the kind of hierarchy that you will find in the hospital. So in a hospital there are two separate sorts of hierarchies. There is that hierarchy that you find in the administrative sector of the hospital, beginning with the hospital directors and so on and so on and so on, but maybe that's not so relevant with you because you're unlikely to be interacting with such people. But the hierarchy that you find on the ward is very, very important to understand. In some countries, the team of individuals that work together to form a functioning unit in the ward or in the clinic is called a firm. This will apply mostly for Uganda. The highest rank you'll find in the firm is a consultant specialist. This will depend on the discipline you're rotating in. So this could be a consultant surgeon, a consultant physician, could be a consultant pediatrician, a consultant obstetrician, a consultant gynecologist, a consultant dermatologist. The list is endless. A consultant radiologist, and so on and so on. Next to that could be the other specialists. Next in the hierarchy is the medical officer. That is someone who holds a bachelor's degree in medicine and surgery. And then you have the junior health officers. These also hold the same bachelor's degree in medicine and surgery, meaning that these are people still doing their internship in the hospital. And then you'll find the clinical officers, and then you'll find an in charge of the ward. That is usually a senior nursing officer or something, and then other nurses, and then nursing assistants. Then you'll find the janitors and and so forth and so forth. One thing that is very important to remember about this hierarchy is that everyone matters. You might basically want to listen to maybe medical officers and those in higher positions of knowledge, but there is also a lot to learn from the janitors and people that you actually think do not really have a lot of medical knowledge. So it's important that you actually respect all these people in their various capacities and learn from each one of them, interact with each one of them. Some of them may not really teach you, with the complicated medical terms you would like to hear, but in their simple understanding, in their simple language, they can always teach you something, because some of these people have cleaned the hospital for over 20 years. Some have been there, 10 years, 15 years. Some even have been for more than 2 decades. So there is no way such a person can actually fail to learn something new. And it will be interesting to learn that some of their observations are some of those very, very important observations that are overlooked by people who have studied in this field. If you're a good reader, actually, there are a lot of things in medicine that were actually discovered by people who were not medical professionals. So it's important that you respect these people and be open to learn from them. It is, however, important to note that this kind of hierarchy does not extend to the students. Because you'll meet students from different categories. You'll meet students of nursing, students of midwifery, and students of clinical medicine, and so forth. But I need you to remember that this hierarchy does not extend to the student body. Why is this important? It's because if you think of it that way, like among students there are those same hierarchies, it's likely that you're not going to learn a lot of important stuff. Remember, irrespective of your level of knowledge or the cadre you are, it is important that you learn, even things that nurses do, because you could end up one day in a situation where, there is no nurse or anyone else to help you. So it's important that you gather knowledge from a diverse variety of sources. So do not pocket when nursing students are around, and then you leave the intravenous cannulations to them, you leave the intramuscular injections for them, and then you just stick to prescription and stuff. That will not be good for you, because as a doctor, it's very important to learn each and every single one of these skills, because they can really be life-saving. A patient can die just because of a failed intravenous access. So it's important that you learn all of these small things. Put down the pride, put down the hierarchies and so on. As a student, you don't need them. Just learn everything, and then once you're qualified, then perhaps you can start to assume that position that you want. In our next video, we are going to dive straight into history taking, beginning right from like the overall architecture of a good medical history, and then we shall also make separate videos for each separate section of your history, and we discuss which qualities make it good or bad, and how best can you take it, and how best can you organize it. Of course, this will come with a lot of practice, but at least I believe out of our sharing, we shall be able to learn a lot from each other. At some point, we shall bring in a few examples here and there. We shall be able to discuss a few cases that perhaps some of you will share with me, or some of those that I've met before. And yeah, I think we shall really get along and learn a lot. So I do hope that you benefit from this video, and I do hope that we continue to interact. I would really appreciate your feedback in the comment box and on other platforms through which you can reach me. And in case you have not yet subscribed to the channel, kindly tap on that circle that will appear on your screen bearing the logo of Medicoria. Just tap on it. It's a clickable link. You tap on it, it will give you an option of subscribing. Please tap on it and subscribe to the channel. See you guys in the next video.